screening prostate cancer?
Yeah, so what I just showed you, that there are several products out there. At least in Europe we can buy 8 different products, and it's difficult to really compare them. When you buy, for instance, a new television, you look up at the internet and see how good the images are and what the features are. It's more difficult to do this with prostate software. So what you really have to try to do is try first where am I buying this product for? Am I, for instance, using it mainly for biopsy targeting? Then you need a product that is really good in contouring a lesion and exporting it to your system. When you're buying it for helping you with finding a lesion, then you need a software that is really good at helping you in this assistive phase or making a report. But you have to realize it's always like a workflow. It's a platform that you buy, and it has to communicate with your PACS system, and it also has to communicate with your biopsy system. And it's different for all the different vendors. So I would recommend you to do a trial for the products, check whether it works and it aligns with your needs. That's the most important. Unfortunately, we cannot yet really compare the different AI products in terms of how good can it really find the tumor. There's no data out there yet that shows us this. So hopefully there will be some initiatives to really benchmark the products better.
That's okay, thank you.
Yep.
I have a question. Thank you for the excellent presentation. From my point of view as a urologist, I think that the use of AI might be easier for CT scanning or other conventional studies. What do you think from your point of view as a radiologist? I think that the prostate cancer is one of the most challenging things that we can employ AI in. So what's your opinion as a radiologist? Thank you.
Yeah, you're right in the sense that CT is less complex in terms of imaging. MRI is often multimodal, so you have T2, you have diffusion-weighted imaging, you have contrast imaging, so that makes it more complex. But the good thing on prostate is that it's always the prostate only. So it's a very dedicated organ, of course, that can be assessed quite well by AI because it's fairly standardized. We look at T2 and diffusion. DCE we do not use actually for AI most of the time. So I think AI is quite good for prostate imaging. Also, for instance, other more dedicated organs like the brains, it's also quite good. But I think it's doing quite a good job. Also because it's a common exam. Like we do quite a lot of prostate MRs, so you have lots of data to train it on. And that makes it actually quite feasible for using AI. Yeah. Yes?
Can AI let us not choose the dynamic contrast enhancement at all, and everything will be in parametric, I mean? Can the AI replace this?
Yeah, so in a screening setting, most likely we don't use contrast anymore.
You know.
So, and the AI out there is also actually not trained on DCE. It doesn't show added value. Actually, what we tend to see now in the PRIME study as well, when looking at the role of DCE for prostate MRI, it only has a really minor role. So I don't think in the future we would, in screening also, we don't need DCE.
And even in the diagnostic cases, can it replace?
Diagnostic cases depends on the patient. So for instance, in selected patients, I think in the future we will use contrast, for instance, patients with a hip prosthesis, where you expect lower quality imaging on diffusion, or patients post-therapy. There the role of DCE is very important, but I think in the future we will shift towards a biparametric protocol, also for the detection cases, in early detection cases.
Okay, thank you very much.
Yeah.
Thank you. Now we'll move to the next